Okay. Good morning, everybody.
Hi.
Thank you for joining. So, there's going to be more people trickling in as always that will be late, but we can go ahead and kind of start with some of the housekeeping about putting your name and agency in the chat so that we can have that for attendance. Caroline, were you going to come join us tomorrow? Yes, good, good. Look forward to it.
Nikki, I have to step out for 1 minute.
Okay.
And Nikki, whenever you'd like, just let me know when you want me to switch to the next slides.
Yeah, we normally give everybody till about 3, 4 after before we get stuff going because they'll like
trickle in.
So
Perfect.
I guess I could put my name in there too, couldn't I? I asked everybody else to, and I did not. It tells you how I follow directions. Okay, I see there's 16 people in now. So again, if you have not put your name and agency in the chat, please do so. That helps us take attendance, do follow-up items as requested as well. Okay, guys, it is 10:02. We will go ahead and call the meeting to order. I know we'll have more people trickle in, so I may interrupt again and ask the newcomers to kind of type their name and agency in. But for now, we will go ahead and get to going because we do have quite a few things to cover. So we will call to order 10:02 a.m. So welcome, everybody. If you want to move to the next slide. We just kind of like to always go over the Yak Yap purpose. We're just kind of here to advise the continuum of care on preparations for the YHDP, Youth Homelessness Demonstration Program application. Also with the point in time count. This year, we decided we were going to only do it every other year, so we get a brief pause on that until next year, but we will be assisting and key in that youth point in time count, and also on any issues and strategic planning activities related to the youth homelessness. So we have had some subcommittees in the past to try to help advise, give our input, stuff like that. So that is kind of the purpose of the Yak Yab Advisory Board. So next is we always like to take a moment. We're going to have some time for everybody to give us program updates later, but right now we'd love to hear if there's any new agencies in the house that are new to our board. If so, please either raise your hand or just unmute yourselves and speak up. Okay, so no new agencies this month. That's fine. And if you guys know of somebody that would be a good partner for us, please, ask them to join us. Ask Monique to send them a link to the meetings if you'd prefer. We're always, interested in expanding our service and our knowledge of what programs and agencies are out there. So, and if you have not, please put your name, contact information in the chat. Helps us keep attendance, helps us do follow-up items as necessary or as requested. So the next item is always the very active part of our meeting, is the approval of last month's minutes. So at this time, anybody who is at last month's minutes has the opportunity to make a motion to approve those minutes. They were available on the link up to that Google Drive. So if anybody would be willing to approve the minutes, that would help us keep going. Is there anyone who would like to make a motion?
Rainbow with Operation Safe House. I'll move to approve the motion.
Thank you, Rainbow. Do we have a second? I just need somebody to second the motion.
I'll second, Nikki.
This is Charles.
Oh.
Okay.
Right.
Sorry.
No, that's perfect. We're interactive today. I love it. Let's go. So at this point, we have a motion and a second to approve the minutes. So all in favor can just kind of like raise their hands, type yes in the chat. If there's anybody opposed, please put opposed or nay in the chat box. Looks like we are good to go at this point. So we can move on to the next item. So this is our moment for public comments. So this is the chance that if people have stuff coming up in their agency that they'd like to announce, or if anybody, well, I guess we'll have that also later in the meeting, but did anybody, means Monique is not here as of yet. She's going to be joining us a little bit late. We hope. So I don't know if anybody emailed Monique to have public comments put on the agenda. Did anybody do that?
And Nikki, I can also confirm that we didn't receive anything in our general COC inbox.
Okay.
But if she did later, we can ask.
Yeah, and we'll have that moment for everybody to give us updates on their agency, because that's always imperative to try to keep in touch with each other. So we are going fast. So the next is old business, which we did the elections the last couple of months. So I apologize. You guys have to put up with me for a while as your chair. We also got to welcome Greg, who will help hopefully balance my disorganization out as our co-chair. So I look forward to working with Greg. So those are the old business. And
We
the
all
next,
have our challenges, Nikki.
I tell you, trying to be a full-time
Yeah.
student, full-time work, I'm dying. So Monique is not here. She was going to cover this. So we had discussed previously on having quarterly in-person hybrid meetings. So you would have the opportunity to come in person or attend virtually. We chose to do every 3 months virtual. We want to kind of update everybody on what, after we had our last one that Greg hosted there in Hemet, and it was very well attended. So we'd kind of like to get some update to make sure everybody's still interested in having those hybrid meetings, and having that in-person option every 3 months. We do have some options. We could just continue to go visit Greg at Hemet, because it is a centralized location that is mid-county. We also discussed the option of rotating them from the desert, mid-county, and then they're in Riverside. I did volunteer that if that is what we want to do, Olive Crest would host us, but that would be clear out in Palm Desert for some of you. Rainbow has said she would host you guys at Operation Safe House. So we'll probably, if Monique has a virtual way for us to vote when she comes on, we may throw that in the link. Otherwise, we'll probably be sending out an email to get everybody to vote on what they prefer to do. We kind of hated to throw all the work at Greg to always host, but he did an amazing job and it went well, and he said he'd be willing to do that. So you had your hand up?
Yes, thank you. So I received a message from Monique, and she said that she planned on having the vote in the chat. So if people could type in, I guess for simplicity's sake, maybe we can do type in 1 for a hybrid and 2 for first person in, or I guess rotate. Should we have 3 options? One for having solely in Mid-County and then one for the rotating between different locations?
Yeah, we could just type in mid-county or rotation,
Okay, sounds good.
whichever your preference is. It's just to stay mid-county or rotation. So if everybody would like to take just a moment, type in the chat what you think you would be interested in doing. We're willing to accommodate what's going to make this more beneficial and interactive for the group, because we were a little overwhelmed by the amount of attendance last time, and that was in a positive way. So, okay. I'm starting to see some pop up in the chat. Thank you. We'll give you guys here a little bit more time. We just want to make it so that everybody has the opportunity to attend if they're interested, make it easy for everybody. So please throw what's going to make it easiest for you, because we want to accommodate as many as possible. Okay, I'm seeing there's a mixture. Please go ahead and keep putting your comment, your thought in there. We would appreciate it, because the next month will be the in-person meeting. So we want to be sure we have that ready in plenty of time. So pretty split. We're pretty close to tight, guys. So please put your comments, your thoughts in there on what's going to make it easy for you if you have not. Is that something you just want to monitor and come back to?
Yes, we can do that.
Okay. Okay, so new business is our presentation. It is on Medi-Cal renewals for the homeless service providers, because it is that time everybody's having to renew. So Riley, is she here?
Yep, I'm on the call. I'm ready to present.
Oh, great. Thank you, Riley. Thank you. So we will hand over to you and let you go. Thank you.
All right, I'm gonna share screen, but before I begin, would you mind just letting me know how much time I have? I don't want to like take up too much time in this meeting.
I'm fine with 30 minutes or so. That's good. Because I'm
Okay.
sure, and there's, yeah.
I won't go over that, don't worry. I just know sometimes when I join some meetings, it can be pretty tight on time. All right, can everyone see my screen? All right, thank you so much. So I am Riley Meave. I'm from Homebase. Homebase is a nonprofit that provides technical assistance to communities across the country, but mainly California communities. And we've been doing this for the past 30 years, helping communities address homelessness and its root causes. So I'm here to talk about how Medi-Cal members experiencing homelessness, including youth, are at risk for not renewing their Medi-Cal and therefore losing their healthcare coverage potentially. And Homebase has been going to communities all across California for the past month, including Riverside, to ask for your help to spread the word and help people experiencing homelessness renew. We spoke, not me, but one of my colleagues spoke at the multidisciplinary approaches to ending homelessness earlier this week in your community. So this presentation is going to look a little similar, but we think it's, you can't hear this information too much. The more you hear it, the more familiar you will be with it. So this slide is something that we just use to alert communities about our campaign. Today, it kind of functions as an agenda. So you'll see that from this presentation, you're going to learn how Medi-Cal renewals have restarted after a 3-year pause, how millions of eligible members are at risk of losing coverage, and that includes people experiencing homelessness. today's presentation, I'm probably going to speak for about 15, 20 minutes and then leave maybe 10 minutes or so for Q&A. But even that, a lot of information won't be covered because Medi-Cal renewals can be a little complicated. So we hope you join us for Homebase's statewide webinar next week, where we'll talk more in depth, and we're also going to be talking in depth about our toolkit that really explains all this in clear, concise, thorough language. At the end of this presentation, I will share the link to register for the webinar and the toolkit for you to review in your own time and share in your community. So just a little refresher what Medicaid is. Medicaid is a public health insurance program that covers low-income households and families and individuals. And every state runs its own Medicaid program. Medi-Cal is California's state version of Medicaid. And Medi-Cal serves almost 16 million residents of California. And Medi-Cal is more expansive than other state Medicaid programs, meaning more categories of people and healthcare services are eligible under the program. So important to keep in mind, like all the vital services Medi-Cal includes when thinking about people potentially losing healthcare coverage. Now, many people experiencing homelessness are eligible for Medi-Cal and are currently enrolled in Medi-Cal. Medi-Cal provides access now not only to healthcare services for people experiencing homelessness, but now also housing-related services under CalAIM. And CalAIM is just a new initiative to improve the health of Californians with the most complex needs, including people experiencing homelessness. And two main components are enhanced care management and community supports, which are two great initiatives to keep in mind. Now I'm going to discuss the Medi-Cal renewals process and the barriers that it's presenting for unhoused communities. And this slide right here, renewal notices come in the mail, but not everyone has a mailing address. This is really the heart of our campaign. We want to address this oversight and the renewal procedures that have been set by the state and federal government. This is really the barrier that people experiencing homelessness are facing, that they won't be, many do not receive regular mail and have a current mailing address. Medi-Cal enrollees must renew their coverage annually. And renewal is just the process for current members to go to their county and show them I'm still eligible to continue receiving benefits. So it's a different process than enrolling. And for the past 3 years, Medi-Cal has not been asking members to renew due to the COVID-19 pandemic, but renewals have restarted as of June 2023. And renewal packages are sent in regular mail and yellow envelopes to the last known addresses of members. Renewals are sent out in batches every month, so people have different renewal deadlines throughout the next year or so. And then once people's their renewals are sent out, members have 90 days to submit their renewal information, and the state could also ask for follow-up information. Over the next year, it's estimated that 2 to 3 million people in California are going to lose their Medi-Cal coverage, including 1.5 million that are actually still eligible for the program. So those eligible individuals are losing coverage because maybe they made an error on their form, or maybe they never received their renewal form in the first place. And that's a huge number, and don't want to see that happen. And if people don't renew, what will happen is they lose their Medi-Cal health coverage and any CalAIM housing supports they're receiving. And individuals that lose Medi-Cal because of a failure to renew can still reapply to Medi-Cal, but that's not ideal, because when people cycle on and off Medi-Cal, it can lead to disruption in care, poor health outcomes, and people experiencing homelessness are more at risk of not renewing and therefore losing coverage. And that's because, as I mentioned, the renewal notices are sent in the mail to last known addresses of members. If someone lost their housing in the past 3 years, like 3 years is a huge window. That's huge, not even just for people experiencing homelessness, it's for everyone who's Medi-Cal members. Yeah, if someone lost their housing and Medi-Cal doesn't have a new mailing address on record that's current, those individuals will not be receiving renewal notices or reminders, nor the renewal packet with information about how to renew in 13 different available languages. For this reason, renewals are something we are hoping everyone in the homeless response system can pay attention to and take seriously. Many Medi-Cal members were worried could lose coverage simply because they don't have a mailing address. Now, renewals, as I mentioned, they're not new. This year, however, there are some exciting special rules that may simplify the renewal process. The first one we got is actually really great news, and we got confirmation 2 weeks ago that the state will now be automatically renewing people who are very low income, meaning they're at 100% federal poverty line or below. And auto renewing means you never get sent your renewal pack in the first place. You don't have to do anything. This process is called ex parte, and essentially anyone at 100% federal poverty line or below should be auto renewed. This automation is supposed to begin tomorrow. This is a huge victory for people experiencing homelessness, and because many people experiencing homelessness are going to fall under this category. However, in these presentations, we're still stressing that it's crucial that providers and COCs still help their consumers determine if they still need to complete a renewal, because some people experiencing homelessness are still going to be required by the state to do a renewal. If the state doesn't have things like updated income information from an individual, or an individual has had a very recent decline in income. And also just want to stress that the automation of renewals is like totally new to California. So we expect there might be bumps in the road as it rolls out. And I will share the federal poverty guidelines in the chat for you all to see. The second special rule is if a county knows an individual is experiencing homelessness, an expedited renewal or re-enrollment may occur. Counties aren't getting that information from like data like HMIS, to our knowledge. They're really just relying on individuals themselves to share their homelessness status. And I will explain in the next slide how someone can do that. If a county renews a member upon learning of a homeless status, that renewal only lasts for a year. The same is true for an auto renewal for being very low income. This is just a reminder that the renewal process repeats itself annually, and it's just important to pay attention to renewals now because of the unprecedented 3-year pause, but renewals have been and always will be critically affecting unhoused populations if renewals continue to be sent in regular mail. Last thing on the slide before I move on, these special rules are implemented at the county level, meaning there may be differences in procedures from county to county. And part of our campaign right now is just to provide some initial information to communities about what's going on. But our hope is that later our campaign is going to be a lot about getting feedback from communities like Riverside and tracking which counties are doing a good job at implementing these rules, or which counties are kind of a little harder to work with. And we're hoping to kind of develop relationships with communities and get that information from you all over the next year. So how you can help, this is the important part of the presentation. Fortunately, there are strategies for helping people experiencing homelessness renew if they weren't auto-renewed, or if you want to determine if they were auto-renewed. Generally, there are 4 ways the state allows people to renew. Anyone who's a Medi-Cal member can renew by mail, online, by phone, or by going in person to the county Medi-Cal office. But renewal through these 4 methods, you kind of have to navigate them a little bit differently if you are a person experiencing homelessness and didn't receive your renewal packet in the first place. And so I'm going to kind of try to break that down in a brief way. But the toolkit I mentioned that Homebase has made, that is like your best friend for walking you through how to renew if you yourself need help. If you're a person experiencing homelessness and need to renew, or if you are a provider, family, or friend helping someone else go through the renewal process. So the first thing that's really important is updating contact information on record with Medi-Cal, especially a mailing address. This way, if Medi-Cal has a current mailing address where a person experiencing homelessness can receive information, that will mean that the renewal packet is delivered and seen on time, or also you'll get mail that you were auto-renewed and know that you don't, or your client, you know that your client doesn't need to follow through with the renewal process. You may be wondering, okay, how do I update contact information like this? One easy way is to make an online account. You do need, someone needs their name and an email address in order to make an online account. But once you do that, within an hour of making the account, you should see when the renewal will be due for that individual. It doesn't that kind of information doesn't connect automatically. A lot of times you have to go back into the account an hour later to see that. And then by knowing when the renewal is due, you can plan to renew online when the time comes. Because as I mentioned, not everyone has a renewal deadline at the same time. Individuals can also visit their county Medi-Cal office or call to update contact information. And so this is the office that processes all the enrollment and renewal forms for county residents. And one benefit of contacting the county office is you can trigger that second special rule I mentioned by having an individual declare themselves as homeless, and can kind of trigger a semi-automatic renewal. And you don't need to wait for the renewal form to come and do this. And if a renewal period has passed, they can also help you, that client or you as an individual, re-enroll pretty fast too. That being said, we have heard from a lot of communities, it can be pretty hard to get in contact with the county Medi-Cal office. A lot of times there's long wait times on the phone or in office, just because this office is responsible for doing a lot of other things besides just renewals. And then on top of it, this renewals period is pretty unprecedented. So it's just important to keep in mind, if you are a provider or friend or family member helping someone go to the county office, by traveling with them or calling the office while the client is present, it may not be a speedy process. But we also, at the meeting we did on Tuesday at the multidisciplinary approaches to ending homelessness, one feedback we got is that 3-way calls don't work with the Riverside Medi-Cal County office, by doing a conference call. So if you were going to do the call option and you were helping someone make that phone call, they would need to be physically present with you and talking just on one phone, not doing a conference call. Homebase recently, as I mentioned, we recently released the toolkit that goes through these processes more in depth than I had time to. And I'll go to the next slide where I'll share some other information for key contacts. So obviously one of the key contacts is the county Medi-Cal office. And then also there are health enrollment navigators. So for the county Medi-Cal office, I provided the phone number, and you all might know the physical location, but online I couldn't find it easily, and it said to call for the nearest location. And then there are also health enrollment navigators. So anyone that needs extra assistance, an individual experiencing homelessness or a provider, can contact a local health enrollment navigator. And navigator organizations are represented in almost every California county now, and these navigators provide free services, and they are trained to help hard-to-reach populations with both Medi-Cal enrollments and renewals. So Homebase is always happy to answer any of your questions, but health enrollment navigators are like trained to know about how to troubleshoot Medi-Cal renewal issues, and they could be a great partner for COCs during this renewal period. And in Riverside, the enrollment navigators are for our Catholic Charities San Bernardino and Riverside counties. These are their phone numbers, and also the Riverside, the Medi-Cal County office is also a health enrollment navigator. I haven't seen that in any other community, so I don't know what exactly that looks like for them. Also, I've mentioned the Homebase Toolkit a few times, but the California Department of Healthcare Services also has their own outreach tools. They're great, simple, easy to share within your community, but they do assume that you're going to be receiving your renewal packet in the mail. And that's why we made our toolkit to kind of address the communities that likely aren't going to be receiving a renewal packet in the first place. So in the chat, I'm going to add the links to things that are in the slides. And I'll move on. So yeah, this slide is all about like how you can help us spread the word after this presentation. The first thing we recommend is to open up our toolkit. Read more about how to help yourself renew or your clients if they're current Medi-Cal members, and the toolkit is on our Homebase website if you ever lose track of the link. So you would just go to Homebase and go under our healthcare resources, and then there's a whole page on Medi-Cal renewals. And if you have any questions at all, you can contact Medi-Cal at homebaseccc.org. This email, you can also tell us about stories about how helping people experiencing homelessness complete Medi-Cal renewals is going. We really want to know what is and isn't going well in your counties, because we can share that feedback with the Department of Healthcare Services and hopefully advocate for a better renewal process for people experiencing homelessness in the future. Lastly, we're hosting a webinar next week, October 3rd at 12:30 p.m. Anyone is welcome to join, and we're going to be setting aside time for meeting participants to ask questions and share their experiences. And also the Department of Healthcare Services is going to be on that call, so we're very excited about that. In the chat, I will share our email and the webinar registration link. And yeah, in the message I sent before, it has the toolkit webpage on there where you can find all the tools that are free to use and download. We have a full toolkit with all the PDFs, but you might not need all those. So we've also separated the tools individually so you can just download what you need, because we've separated the toolkit by kind of audience for providers, for people experiencing homelessness, and then for health enrollment navigators. That is all I had. Now I can take this time for questions if there are any. I think I see a hand is raised.
Yes, Michelle.
Hello. Yeah, Hi. So I have a couple of things. For foster youth, are they going to automatically be renewed, or do we have to work with the ones that are on the call that are the transitional housing providers for the foster youth? Do we have to sit with them and help them to renew? That's my first question.
Yeah, so luckily, I think we're hoping a lot of youth are auto renewed because the federal poverty guidelines I shared, that is for adults, and there's a higher federal poverty line for youth. Other than that, I don't know any other like specific procedures for foster youth. I would like love to ask our contacts at the state, and I can follow up with you if you provide your email.
Yeah, because I think that would be important for us to know if, I mean, we can ask them if they're getting letters to renew. I don't know if Nikki's having the same question because they're supposed to be eligible for their Medi-Cal until they're 26. So that would be one thing. And then the other thing that I was wondering is, how are the homeless informed? Is there an event that can be held where they could show up and someone can assist them with getting their Medi-Cal renewed, or is that what they're doing through Catholic Charities? Like, I'm imagining there should be like a one-day event.
Yeah, that is a great idea. So we don't know exactly, like we're doing outreach to like all California COCs, and we haven't had the opportunity to touch base with like all health enrollment navigators. And we're hoping by these initial outreach presentations, you all could like help maybe develop a partnership with your health enrollment navigators and see what they could offer if they could do an event like that in partnership with you all. And if like your community decides you want help with that, like we'd be happy to help maybe facilitate that introduction. Homebase ourselves doesn't have the availability to like do those types of events in all communities, but that is like that's a great thing to think of. And we've heard of other communities thinking of starting initiatives like that.
Yeah, I think that if there was a community-driven event where there's computers and if it's announced like on social media, and that was the other thing in terms of how they're informed, a lot of the homeless community does maintain their social medias and their phones, their cell phones, as a way of staying connected. Maybe there should be some sort of advertisement on Instagram or TikTok or any of the other social medias. Because I do see like when grocery stores that are in the area are having grand openings, they put something on there, and or like clothing stores or whatever, it would be a good way to announce so that the homeless community does know what they need to do.
Yeah, one thing I'll add is anything Homebase has made, any materials, like you all are free to use. You don't have to like ask permission. So our toolkits, like you can use that to advertise on our social media, like LinkedIn and Facebook. A lot of our outreach has been more to like COCs and providers. It's harder for us to get in touch with people experiencing homelessness, but you could like use our graphics if that makes it easier for you. Just wanted to share that.
Thank you.
We put these links and this information available on our Google Docs on our link so that people can get on and print out maybe at a more convenient time.
Now, the slides on a document, or did you say the links?
The link for
The
like
links?
yes, on how to
Yes.
contact the
I'll
home
save-
toolkit link, that kind of stuff.
Absolutely. I'll save the chat after the meeting's done and make sure that a document is sent out. And I'll let Monique know as well.
Right. Did we have some more questions?
Rainbow here with
oh.
Safe House. Sorry, I just wanted to thank you, Riley, for sharing this information. I know it's educational, and I know that people can get frustrated with Medi-Cal renewals because can be difficult for clients. But you know, you guys seem to make it easy, and you don't have to. So much appreciated, and thank you for sharing all this information.
Yeah, and if there's anything, other information, I believe Nikki has like you all have our contact information now, the email, but like throughout this next year, if there's more information you need, and if renewals like do not seem like they're way harder of a battle than they need to be, let us know, and maybe we can provide more information, update our tools, things like that.
Hey, any more questions? Okay, I
Yes.
believe,
Oh,
yeah.
sorry, Nikki. I do
Go
actually
ahead,
have a
Maria.
quick question. So I was just wondering, since I'm sure you've done other presentations, did any other questions come up from other meetings that you had about challenges that youth specifically face with just with their medical insurance?
Yeah, this I think is the first time
Oh.
we've done a presentation at a like youth advisory board. And I had asked my team before if there was like I needed to change any of the messaging, and based on their knowledge, they didn't think so. But I'll follow up with some other people about the question Michelle asked earlier.
Awesome. Thank you so much.
Thank you. I appreciate you coming to share that. I think Monique is close to being able to join us. So if we want to slip forward 2 slides, we can maybe do our bed availability until she gets here. The next one, and then we'll pop back up. So our agency bed availability at this time, we do encourage people to share if they have bed availability and what that process looks like. So as far as the transitional age youth that are aging out of foster care off of juvenile probation, there is a link again that can take you to every one of the providers that's contracted with Riverside County, available on the Google Docs. We try to keep that bed availability up to date. Probably need to do that. I can tell you Olive Crest, this is for the young adults aging out of foster care off of juvenile probation. Olive Crest has 2 male vacancies in the Moreno Valley area. Michelle, what do you guys have any bed availability at this time?
I have 2 male or female in Moreno Valley. I have another female in Moreno Valley. So the 2 that I have are because the unit is empty, so it could go either way. And the one that's completely empty is near the college. I have a male vacancy in Corona that's near the Norco campus. And I have 1 parenting youth that's close to UCR. And I have a male vacancy near UCR. And then I have male and female kind of within the city limits. So I have a total of, I think, 7 vacancies.
Okay,
So
great.
if anyone has any non-minor dependents that are aged out of foster care, feel free to get a hold of me or Nikki.
Yeah. And again, I tried to make it simple on that Google Docs. There's every program listed that's contracted with Riverside County. It has their name, it has their locations, and it has the contact information to get the applications there. This again is specific for the youth, juvenile probation, or foster care. Caroline is also on if you want to introduce yourself as far as the foster probation realm too, Caroline.
Of course. Hi, everyone. I'm Caroline Quintos, Housing Navigator with Thrive ILP. I work with the non-minor dependents in Riverside County. So those are the youth ages 18 to 21 that have decided to extend their foster care. which gives them eligibility for other housing options such as Aspiranet and Olive Crest. So if anybody has any youth that fits into that eligibility, they also need to be ILP eligible in Riverside County. I'm happy to support them in any way I can, help them fill out applications, submit them, go over the different programs available to them. And so I did earlier put my number in the chat, my emails in the chat, so feel free to reach out to me if you have any further questions.
Okay, thank you. And that's all I saw for the Foster Realm Rainbow. Did you guys have any bed availability at this time?
Yeah, so for the emergency shelter, for Tay, ages 18 to 24, we currently have one male, one female available. And then for the TLPs, Harrison House in the Desert is full. And then I'm checking on the Riverside location. So I will just circle back to me.
Sounds good. And Rainbow, you said Harrison House was full. Was that also for the vouchers as well? FYI vouchers?
We have one available unit for a FUT voucher.
Okay, great. Is there anybody else that has bed availability that they'd like to share with us? Oh, here's that Google Doc that shows for the extended foster care youth. All the programs.
Sorry, Nikki. I just got the availability. So sorry. Let me just give this to you real quick. So in Riverside, we have one male opening for downtown Riverside, and then one female. And then we actually have 3 FUT voucher units. So.
Perfect. That is great. Thank you. And if nobody else has bed availability, kind of pause a second to see if anybody does. Okay, it doesn't sound like it. So at this point in the agenda, I would like to kind of go backwards because I saw lovely Monique pop on. Hi! So Monique was busy in the field, guys. So we kind of quick jumped past so that hopefully you didn't see the slides because now we're backtracking for Monique. So welcome. Thank you.
Thank you. Hi, everyone. I am so happy to be able to jump on and give you all the amazing news and update. And so at the end, we have a platform just acknowledging all of the folks from that participated in this process. But we were awarded YHDP. And so I know that every time that we go over our meetings, we discuss our roles and responsibilities as the Youth Advisory Committee and as youth partners and providers. And one of our goals for this committee is working on the YHDP application. It's one of the largest grants that HUD has available for youth funding. And so we've always wanted to receive this funding. And I know that we've worked hard to improve that process year after year. And so we finally have come to a point where we have a good system and a good plan in place, you know, and we have a lot of stakeholders who have such a passion and a heart for supporting youth experiencing homelessness. So we're hoping that we can do great things with this. And if you advance to the next slide, please. So there's a lot going on here, which you all can kind of look at through the slides afterward. But some of the main things is that we were awarded $7.4 million. If you all recall from our conversations, the grant was asking for an amount and we had asked for $2 million. And so HUD sees the potential in what we can do with this funding and tripled the amount. So we're receiving $7.4 million. And we are one of 16 communities that were awarded, and we were the 3rd largest allocation. So we should all be very proud of ourselves for having come together so many times a month to really discuss what are the needs in our community. I know that you all participated in our needs assessment gap. the year prior to this one as well, and that really set us up. So thank you all so much again for having participated in that to really identify what the need is and how we plan to fill that with programming, youth-specific housing, as well as wraparound services. Next steps really are to plan. We're going to do what is the Coordinated Community Plan, the CCP. I know that we discussed it briefly in our previous YHDP meetings, just really going over, what we're going to utilize the funds for and bringing in all of our key stakeholders. We will utilize 3% upfront to plan. And so it's going to be a good way to really bring in our youth, compensate them for their time, and make sure that they are integrated and that their voices are being heard. We need to follow, what the entire community thinks is best. So we do want all of our stakeholders to be at these meetings. I will follow up in the next few weeks with meeting times, asking for folks and their availability, as well as making sure that we have all of the key stakeholders. So if there's someone who's not coming to this meeting yet or who should be, please invite them, send them the Teams meeting link, send our team an email, send myself an email, and we'll go ahead and get them connected. But please think about attending our CCP meetings here shortly in order to really let us know what are the needs in your specific community, where the highest need is, and identifying, what kind of services and housing and what that housing for youth looks like. And so, again, we're going to look towards some of the agencies that already have similar programs that maybe we can mirror. So we value and appreciate everyone's opinion in this planning process. And I look forward to spending the next 6 months really evaluating our system for youth with you all. And so our hope is that we can incorporate that into these meetings as kind of a part of our YAC-YAB, since everyone should be involved. And, this is going to benefit hopefully a lot of the youth clients that you all currently serve as well. So look forward to that. Thank you so much. Any questions? No.
I'm not seeing any questions, but Monique, we really need, I know you're thanking us, we really need to thank you. The amount of time you spent on this, that video you put together was amazing. Kudos to you. Thank you. I mean, this is you.
No,
This was
maybe
your
we can
work.
You're funny. Maybe we can move over to the spotlight. I think that's next on our agenda, to really highlight all of our key stakeholders and players in this. Oh, our next Youth Action Board meeting. So really, as we're talking about, folks that were essential to this operation, it really is our Youth Action Board. And I don't know if Jashelle is here, and if folks have time, have we shared our YAB video with folks? Nikki, do you mind if maybe we share that YAB video and kind of put it on for folks?
Because we did have it at the in-person meeting, but there was a lot going on at that time.
Yeah, let's put that on because really, without our YAB and without HUD knowing that we have a YAB and that we have youth that are dedicated to this work, without folks like Jashelle Scott who, are brought on and are asked for their expertise, their time, and even in some difficult moments, they still kind of push to really let us know what is making a difference and what is being impactful. And so we really do need to thank our youth and down to our youth clients, all of the clients that come in and make our agencies work and let us know what's going on. And sometimes, they're not happy about what we're doing, but we need that in order to really know what we should be doing then and how we should be supporting them. So if we can share that video, let me pull it up real quick and see if I can share. And then Jashelle, are you on? Do you want to share a little bit about our YAB meeting today and kind of what are some of the items we'll go over?
All right. Hi, everyone. I'm Jashelle. So for today's YAB meeting, we're going over pretty much some plans on how to spend that YHDP grant. So we're going to go talk about a couple things of what their opinions are, what we can start off with. We are going to talk about filling out our new timesheets and just we kind of just go over regulations each meeting, making sure everyone knows the guidelines and regulations, and yeah.
Thank you, Jashelle. And for our upcoming meeting, we will be planning for a resume workshop building. So we're going to carve out some time to work on folks and their resumes. We're going to talk about employment, work with workforce development. So we're really excited to really bring your youth and just provide them additional support as well. And then have them be a part of our CCP planning. Your youth and your youth clients, as well as our youth action board, are going to be really important stakeholders. So please think about relaying the information to them, encouraging them to get involved, and we will compensate them well for their time. We definitely want them to be involved, but also feel and see the change happening, especially for some of our youth members that have been involved since the beginning. I'm going to go ahead and share this video real quick. Let me know if you all are able to hear and see it. Can you hear and see it, Nikki? Yes. So the YAB has been in existence since 2019. I was a part of the first cohort of youth, and I am now the homeless youth coordinator, but I too started as a YAB member. Since I started in 2021, I am happy to say that we have had, a few YAB members graduate from YAB and move on to other forms of stability, educational opportunities, and now some of our YAB members are working for the agencies and programs that provide homeless services.
The mission of YAB is to prevent youth homelessness. The mission of YAB is to provide assistance for youth, to give them the necessary resources to help themselves, such as housing, funding, and other basic needs.
The mission of YAB is to cultivate resilience amongst our youth and teach them to use their personal and lived experience to support other youth who are struggling with housing instability and connect them to services.
The mission of YAB is to prevent youth homelessness and provide resources to at-risk youth.
The mission of YAB is to provide resources for youth to help them get back on their feet. YAB is very reflective of the community outside, Oftentimes it can be an outsider looking in, but with the group and the youth that we have had the privilege to band together, we all have experience in homelessness, housing insecurity, and we can put that to use to connect with the community outside of us. Youth are recruited from system-impacted programs. A lot of our youth do experience criminal backgrounds, so we want to be there to help support them, because sometimes youth feel like they don't have the support just coming from where they come from, but we all go through things. So we want to be there to support and encourage the youth and let them know that they can get on their feet regardless of their background or where they came from, because there's always a way. YAB have 14 members. 2 of our YAB members are student paid interns who supports our members and our mission.
Members are recruited to YAB through transitional living programs and emergency shelters like Operation Safe House. Some of the biggest risk factors for me personally was economic hardship and family instability. Unemployment, low wage jobs, low credit scores. It was really hard to find affordable housing, and just family instability, substance abuse, mental health issues, and strained relationships. So those are two of the big risk factors for youth to enter homelessness.
Is hard at times because I am a single mother too. At the same time, you know, having to have a full-time job and needing gas or just needing the support to be able to get to YAB, it can become hard at times to where sometimes we might not have babysitters. Like I said, sometimes we might not have the funds, sometimes we might not have the support, and sometimes we go through things to where we just don't want to get out the bed, to where we feel like we're not, me personally, are just there.
I had just turned 18, so I had no credit score. So it was very difficult for me to even find a place on my own with no savings, and I didn't know of any resources to connect me anywhere because no one around me knew of any resources.
For experience, I experienced a lot of depression growing up, and when I was experiencing homelessness, which stopped me from a lot of things, there will be opportunities for me to opportunities to get help, but my mental wasn't right, so I just didn't feel like doing anything. I didn't want to talk to people. So if we're there to support and encourage, our team will grow bigger and our youth will be successful.
So as the Homeless Youth Coordinator, I am currently involved with a few projects that show our YAB decision making. And so YAB is involved when it comes to decision making about funding allocations. And so our YAB and myself have utilized the 6% for our HAP funding to fund some new youth agencies that are going to provide rapid rehousing services for youth. That's one decision-making process that we're involved in. The other one is just making sure that we're prioritizing our coordinated youth entry system so that it can take all of the youth referrals that we have, and so making sure that youth are prioritized through the TAY assessment tool, and also when they're calling and looking for resources, and making sure that we can provide preventative resources as well.
I feel like we're really in need of more apartment complexes that are dedicated to our youth. I feel a lot of youth struggle with explaining what they're going through. So maybe if we came up with a 24-hour anonymous chat that, you know, they could speak through and communicate their problems, and we could provide the resources through there.
I feel that we could do more with community outreach. You know, if someone were to take the time and just say, what can I do to connect with the youth? That would really make a difference in the way that we could, you know, put an end to a lot of the things that are happening around us.
I would define this success as, you know, seeing those numbers and youth go down for homelessness. I feel providing more resources and housing for our youth will be my definition of success.
I defined it by having stability, being able to get up every day to take care of my children, to be able to feed my kids, to be able to go to my job, to be able to give back to the community and help more youth.
I would define success by ensuring that homeless youth have a safe place to sleep, food to eat, a case manager to help them develop a long-term plan to transition into adulthood, and to help start building a savings.
I would define success as ensuring that the youth can get a lot of the things that are troubling them out of their way, you know, with housing insecurity, with ensuring that they can get a full education, ensuring that they have, you know, the necessary tools to better themselves and to help others along the way, you know, creating a sense of unity and ensuring that we can all work together to combat and hopefully eradicate youth homelessness.
I would define success by having more housing availability for youth as they're exiting and experiencing homelessness. I would also define success as youth not having to experience homelessness for long lengths of time. And so if we can make homelessness for youth rare, brief, and non-reoccurring, I think that would be success for us.
I want to help the youth overcome the challenges that they go through every day. A lot of them become homeless at such a young age. Some of them have no support, some of them have no parents, some of them have no motivation, to where I want them to be successful as well, to be able to say, I'm here, I did this, I am far from where I became, I am me, and I'm finding who I am today. And I am Yab.
I am Yab.
I am Yab.
I am Yab.
Oh, sorry. Sorry, folks. I know that we've taken, sorry, I know that we've taken quite some time now to view that, but I just really wanted everyone to see the YAP video because it really was a large effort from our Youth Action Board. It was having to discuss, right, things that, right, were traumatic at some point in life. And so just having their support during this application process has been huge for us. But also if we go on to our kudos slide, right, we do want to give kudos, and our member spotlight is all of our members, right? It's our key stakeholders, and it's our key partners that really supported us through that YHDP process. Folks that, you know, were doing a lot of behind the scene work. If you all remember Laura Gonzalez, an amazing team member here at the COC. She was essential to the years prior to us. And so she really laid down a good foundation and a good pathway for us to start thinking about all of the items that we needed to put in place for this application, but also for our youth. And so we appreciate our team here, right? I know that we had a lot of team members the year prior to applying that were essential in just making it happen, collecting all of the items that we needed, from letters of support to working with all of our amazing partners on this call to create the needs assessment. Our team has been, you know, fluctuating, but all of the folks that have stayed still, right? And then also just submitting the application, right? My supervisor, Natalis, was essential in a lot of that background work, but also I appreciate, right, Mar, Jesus, you guys are amazing for just doing a lot of that saving of items and making sure that the communication between our partners was good. And we can't thank Operation Safe House enough. In the video, if you see that, Rainbow, am I allowed to share that? It's a really nice space that they have in their program, you know, and if Rainbow, if you can tell us just a little bit more about the youth, right, you know, I want to give you some space. I know that Julie was working on a lot of grants during the same time, and still she was able to support us with a lot of data and incorporating a lot of information. But if you want to talk to us a little bit about your experience with this process and allowing us your space, Rainbow.
Sure. Well, Monique, honestly, I can't say enough how beneficial you've been ever since you even stepped into the YAB in 2019. It's just skyrocketed from there. So without you, it wouldn't have happened. But yeah, Safe House has been we've been partnering with the county for years trying to get the YHDP grant. And, you know, I've also talked to other counties in regard to the YHDP grant and what they do, and none of them have been able to get it either. So it was kind of a shot in the dark for many, many years. And so even with other counties participating, like San Bernardino County, it was such a huge struggle. So in order to get this, I'm sure a lot of the surrounding counties are just mind boggled as well. They're just, you know, it's wild. When I tell somebody from San Bernardino County that we got it, they're just like, excuse me. So, you know, that does show how much of, you know, how much work we're putting in as Riverside County. So that's awesome. As far as our space, that was located at our transitional living program. We do have a YAB member in one of our current programs, Savannah, who you've seen. And, you know, I'm not going to share her story because that's her purview. So, but it's a huge thing to be able to help a youth and then for them to advocate while they are, you know, in the thick of it. It's just amazing. And so a lot of our youth aren't in that place, and that's okay. But to be able to help a youth and for them to actually advocate for not only Safe House, but for themselves, it's amazing. So our transitional living program, as most of you know, it's an apartment complex just for youth, and it definitely allows them to be themselves. And that was actually located in our rec room, where the youth can, do whatever they need to in terms of homework. They could play pool. They can. It's a rec room, just like any other apartment complex would have. So they have life skills in there, so on and so forth. So I don't, that's pretty much it. I don't know what else to talk about that space, Monique, but yeah, I don't know.
No, thank you so much for allowing us that space. When the youth were deciding where to film and where to make that short video for us to submit with our YHDP, they were thinking about what is comfortable and what is familiar, as well as what makes them feel good to be in. And it was that space at OSH. So thank you so much, Rainbow, for your partnership, your team, all of your amazing staff, right? AJ and his time during our YAC meetings, and just really supporting us in that application process as well. So we cannot thank everybody enough, all of our members here, all of our TLP programs, and of course all of our COC staff who are always in the background making sure that we can all get together and make things happen. So if anybody else would like to give any kudos anywhere or discuss anything else about YHDP, I know Greg and Nikki have been, as our chair and our vice chair, and even before these roles, have been essential to really making sure that we're identifying what youth need. So if you all would like to comment on anything, then I'll pass it back to you, Nikki. Sorry, I'm always hijacking these meetings.
It's just good to see these young people move forward. Carlos was in the video. I just saw Carlos yesterday. He's a dynamic individual. He's got a lot of growing to still do, but his outlook has just become so positive at being connected with these with his peers, with his group. So seeing them advance, and then Giselle herself, she's been with us at the meetings. It's just great to see them grow and move forward, and not the discouraging things still come their way, but they don't get down because there's a lot of support for them out there. We just gotta help them find it, really. So great video.
Thank you. All right, Nikki, back to you. Thank you everyone for your time again.
So thank you, Monique. So that is awesome, guys. And I know we kind of jumped all over, but I mean, getting this grant is huge. And everything we kind of jumped with the slides kind of incorporated around that. That's amazing. And I look forward to seeing how much we can accomplish with this. It's going to be a task yet to come, but it's going to be exciting. So, if we kind of backtrack up a little bit, we gave the bed availability updates, but now Monique, if you would want to talk about the revamped flyer and recruitment, because we've been talking about YAP, so let's talk about how to recruit.
Definitely. Thank you, Mara, on our team for creating these flyers, and then thank you, Giselle, for distributing them and promoting them. These are our new flyers. If you have youth members that would like to join YAB, again, this time is going to be crucial for them to join in relation to YHDP. Please have them reach out to myself, Giselle, or scan the QR code on the flyer. We will make sure that that's in the Google Drive as well. And like Giselle mentioned, our next YAB meeting is actually today from 4 to 5:30. So please let us know if you have YAB members that are available or youth that would like to participate. We'll go ahead and send them over the information as well as the meeting invite, and they're welcome to join today. And we're just going to go over some brief YAB items as well as our timesheets and how we're going to compensate young members, and then talk about, YHDP and what that looks like for our youth moving forward. And then Giselle is currently updating our resource directory, so you'll get a call from her if you haven't already. I'm just asking if the information is up to date, if your agency is still in the same location, and if you have a point of contact person that works with youth, our YAC or our COC directly, just because it's always easier for us to call and say, hey, I was on the YAC meeting and, Greg referred me to Nikki, right? And so being able to make those connections is what we want all of our partners to be able to do, is have a point of contact, have someone that they can reach out to to really facilitate, right, how we navigate youth through our system. So thank you so much, Shishelle, for continuing to work on that. And she will provide everyone the updated copy in our Google Drive, as well as via email. Next slide.
Yep. Okay, now the other Monique for CES updates.
Thank you, everyone.
Monique wasn't able to make the meeting today, but I can go ahead and give the updates for CES. So currently on the CES community queue youth, we have 63 on the community queue awaiting housing and navigation. Currently out of that, there is about 34% are the age of 23, 27% is the age of 20. 19% is the age of 22, and then 18% are the age of 24. We've had 16 youth call our Home Connect line in the month of August. Currently, individuals that have been assessed that are on the queue are 62 youth that are on the queue. Most of these youth are coming from the city of Riverside. Next in line would be the city of Hemet. We have in Riverside, about 25 youth in the city of Riverside currently that are on our community queue. And that is all the updates I have for you currently. If you guys have any questions, feel free to ask.
So is that what we're moving into 7.0? Okay, before I do that, I want to backtrack just a little bit, because in the new business category we were talking about, and people put in the chat whether or not they would like to continue on with our meeting places, continuing on with this hybrid format, and then either rotating a schedule or just keeping it in the mid-county area. And I noticed on the chat it looked like there was about 6 or 7 that were saying rotation, and a couple were saying keep it in the same. So I just want to address that real quick. If Monique wanted to speak to any more of that, we were doing that kind of a comment before you got onto the meeting today.
Definitely. Mar, has our team assessed in the chat what that vote looks like?
Yes, so we have a total of 9 votes. 6 voted for the rotate option and 3 for mid-county. And I would like to preface that was at the beginning of the meeting before quite a few people hopped on. So I don't know if you wanted to have space for more people to vote.
What we can do is I can follow up after this with a doodle poll and then send out where our meeting location will be in October, to make sure that everyone has time to vote. And again, folks, we did do this mid-county in July, and we did have a really good turnout. It really gives you the space to partner with folks, collaborate, get together after the meeting. And so we do see that it is beneficial for us to do quarterly in person. But again, we do need everyone's opinion and vote for this so that we can make a decision. But I will go ahead and send out a doodle poll just to make sure right after this meeting.
Thank you, Monique. All right, so I will put it out there, a call for agenda items on our next meeting, which will be in October. Put it out there if anybody here at this meeting wanted to have any things added to the agenda. Please feel free to either put it in the chat or just let us know.
Question. You could say no. Do we, so I don't know if we've done this in years past, but should we bring up a conversation of like holidays, like for example, getting our YAB members, some some stuff during the holidays. Like, you know, I did notice that, you know, one of our YAB has children. So is there like a conversation that we can start about the holidays in terms of anybody who's having hardships and stuff like that? I do know there's several cities that do, you know, adopt a family, stuff like that. So maybe starting that conversation.
I think that's a fantastic idea. Here at California Family Life Center, we do our own annual Christmas drive, again, through our foster kids, through our kin care kids, through our group homes, through, I mean, pretty much the youth in all three of our centers, our adoption agencies, all that stuff. And so we have a big Christmas push, and we actually get to distribute to, you know, I'm going to say probably between 200 and 300 kiddos that get pretty much anything they could have ever really wanted on a wish list at Christmas time. So it's a big thing that we do every year for our group. And it's something that's, to me, simple to incorporate. Again, like earlier on the video that was playing, Carlos is one of our participants. And if Carlos had children of his own, we would be getting Christmas gifts for his kids, as well as probably Carlos himself. So we kind of extend that out to everybody in our family, but it's not that difficult to extend it out to those that are on our Yak and Yap group, especially if they have kids of their own. Not to, you know, not do anything for those youth themselves, because they are working hard. So Rainbow, I think it's a fantastic idea, and I would jump on board to get out some wish lists out there.
Hey, Maria, did you have a comment as well or a suggestion?
I do. Hi, everyone. Good morning. My name is Maria Arnold. I'm the program manager for the Parent Support and Training Program here for RUHS Behavioral Health. I just wanted to offer our snowflake project. So it's kind of like a Christmas drive, but we call it a snowman banner project. And every year we give toys and items to families in need. So I am more than happy to include the YAB members in that, or any other youth that could possibly benefit. So I don't know if I could get a request form out. We already have those ready to go, actually. I think Vanessa's here. Vanessa is my coordinator for these things. Oh, there she is. Hi, Vanessa. So Vanessa and I would be happy to work with, I don't know if it would be through you, Monique, or maybe through Rainbow. I could give you guys a request form and you can start filling them out. And it could be for the parents and it could be for the children. I mean, that's, we get a lot of requests every year and we try our best to fill them. So, I mean, we don't have to be the only people that, you know, fill those requests, but we'd be willing to participate and help out.
Yeah, I think it sounds great. I think for the next meeting, what we can do, Nikki and Greg, is if folks have any events that are coming up that you would like support in, or if you're able to provide anything to the youth in this group, or if as a group we want to identify some of our most vulnerable clients, and then also do something in particular for our Youth Action Board members, which is our youth group, then I can put together some slides, put some flyers, add that information in the Google Drive, and make sure that everyone in October has access to them, and we can start kind of giving everybody a few minutes to discuss what they're doing, what we should do, and then we can put it as an agenda item for discussion as well. But yeah, Maria, if you want to send me that, and then Greg, as soon as you have a flyer for your event, you can send it to me as well, and we can start putting all that together for the next PowerPoint meeting.
Yeah, our wish lists are out there now, so I'll just I'll send you a copy of it for sure. I mean, who doesn't like PF Chang's? Who doesn't like a Walmart gift card? Who doesn't, you know, I don't care how old you are.
Amazon.
There you go.
Yeah.
All right, so there's one item for our next meeting agenda item. Anybody else like to share, put in a request? All right, thank you. And then moving into number 8 is our announcements. And again, this is an opportunity to make any type of announcement with this group, events, activities, anything going on in your community, again, that are really related to the youth and those that we serve. please feel free to, again, jump in, share it with us, or type it into the chat. We encourage everyone.
Amir has his hand up.
Oh, there it is. Amir?
Hi, I just wanted to remind everyone I did kind of bring it up in yesterday's meeting for those that were there. The bridge at Silence Loud is having our soft grand opening on October 21st to kind of introduce our facility to the youth. There's going to be plenty of just different vendors and activities for the youth to interact with, and we would love to invite some CLC members out to pass out the resources to the youth that might need it. So should have the flyers done by this week, and then I could give them to Monique to send out to you guys if you would like to come out and share your resources with the youth that we have coming out to our event.
Fantastic.
Thank you, Amir. Go ahead and send that to me and I'll send it out.
All right, thank you.
There's a community event going on out in the San Jacinto Valley today. MSJC has their Eagles Landing resource event that's going on until about 2 o'clock. So if anybody is out in this area and they want to check it out and see who's all out there, I would be out there, but I'm here today. So I had to miss it, unfortunately. That is, again, at the MSJC San Jacinto campus until 2 o'clock today. It's their second annual resource fair. Earlier, someone was talking about how we can get the message out, and I believe it was with Riley and that connection for these providers that are out there. I spend a lot of time at our AJCCs, anytime that they have career fair, job fairs, anything like that, as well as with our community colleges, RCC, the Barry Bond Center in Riverside, wherever things are going on, I try and get out to just to let them know that even though I'm out here in wonderful little San Jacinto Valley, I'll pretty much go anywhere in the Pass area, Menifee, Murrieta, Temecula, the Mountain, you name it. We get all over the place. Again, with the 3 centers that we have, and then Equus Workforce Solutions has 3 centers. We're all over the place. So that's just my little announcement. Any others?
Caroline has her hand up.
Caroline, there we go.
Yes, I just wanted to remind everyone that Thrive ILP has started our Q4, which is community resource development. So we serve youth ages 16 to 21, current and former foster youth, probation youth that are ILP eligible for Riverside County. I will again put the Thrive ILP number in the group chat. It is best. I would suggest if you do have a youth that may be interested to call the 800 number to see if they are already eligible. And if not, we can figure out how to get them eligible and ILP referred. Okay.
Thank you.
You're welcome.
Any other announcements?
And then Greg, if I may, just a reminder that the City of Riverside does have their youth case conferencing calls on Mondays for youth in the City of Riverside that are experiencing homelessness, as they are doing the Mayor's Initiative to End Youth Homelessness. So if you do have clients in the City of Riverside or are serving the City of Riverside and would like to go to those case conferencing calls to discuss your youth clients, please let me know and I can go ahead and facilitate an email over so that you can be added.
Fantastic. Thank you.
Hey, Greg, it's Rainbow here with Safe House. So we are having open houses for both of our youth centers, which is the shelters for minors 11 to 17, and it's solely for youth providers or anybody in the community who wants to actually go and see our centers and see where they're referring, youth to. We have one in the desert, and that one's going to be on October 26th, and then that's from 5 to 7:30. And then the one in Riverside is actually going to be on October 19th, and that's from 5 to 7:30 as well. I can send those flyers out to Monique. And then if you want to attend, you just RSVP and that's it. But we thought it's a good opportunity to kind of see where you guys are sending youth to and where your staff, sometimes we're curious as to what happens to our youth after they enter shelter. So yeah.
That's fantastic. I believe I RSVP'd and 3 of my staff are coming to the Riverside location. Thank you for that. I've visited, but there's always things that are changing. So I want to encourage everybody, if you get the opportunity, again, your staff for the provider part of it. We're not going to be dragging any youth along with us, I don't think. But I do have some staff that are going to come along. Thank you for that, Rainbow.
And if you do send it to me, Rainbow, I will send it out to the group and make sure that I encourage everyone to RSVP and check out OSH if you haven't, as they are our youth and minor shelter with their 2 locations in the Riverside area and in the desert. Thank you, Rainbow.
And once again, any other announcements, please feel free.
Hi, this is Maria Arnold again. I'm sorry.
Hi.
Just really quick. I put in the chat that our program just received donations of brand new desks, like for students to use. They're pretty small. They're not like overwhelmed, like really large or anything. Like they're pretty, like they would fit in an apartment or so they're really useful. And again, they're brand new. They're already put together. We have 9 of them and we are trying to get them to someone who could really use them. So if you know of any youth who might benefit from a brand new desk, please just contact me, or you can contact Vanessa. She put her in, and for Vanessa Lopez works with us here at Parent Support. We will get that desk to you, or you can come pick it up. It'd be preferred that you come get it. That, and then I also wanted to announce that our children's department here at the Myers Complex, if you're familiar with behavioral health in the Myers Complex, we're having our annual Fall Festival on October 26th from 4 to 7. And we are going to have, music, free food, a petting zoo, a place to take photos. It should be a lot of fun. Giveaways. We're encouraging staff, adults and children to dress up for the to have like a fashion show, a costume fashion show. It's not a contest, it's a fashion show. So if you'd like, if you know any families that would like to come and participate, I will send the flyer out. Maybe I can send it to Monique. Can I send it to Monique? Okay, I'll send it to Monique, and then just make sure the family's registered. Or if you would like to have a booth there to give out your resources, you can also contact us and we'll make sure to get you a table and chairs. We are providing those. So that's it for me. Thank you.
Fantastic. The desk doesn't happen to come with a chair, does it?
No, it doesn't.
Okay. All right. Well, I know one that might be able to use one. So Monique is that out. I might be able to get a name back to her. But thank you for that.
Of course.
Thank you so much, Maria. And again, folks, if you all send me all of your flyers and items and events by today, I can send one single email with everyone's flyers and items, but also I will put them all in the Google Drive. So if you go to the Google Drive for today's meeting, you should see all of those and make sure that you put them on your calendars. Thank you, Maria. It's always nice having you. Maria's a good resource, folks.
Contact information in the chat. I was having problems finding that.
All right, going once, twice, 3 times. I think we're done with our announcements this morning. Going to go ahead and call for the adjournment of today's meeting. I want to thank everybody for being here with us today, those that can make it all the way to the end. We're going to give you back about 25 minutes of your morning. And again, if there are no other announcements, I go ahead and we'll adjourn this meeting today. Again, on behalf of your Yak Yap group here and the Continuum of Care, Appreciate your time. Y'all have a good day. Take care.
Thank you. Bye, everyone.